Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, I'm going to share with you two different wedge pillows or bolsters that you can use either before or after surgery, share how to use them and what are some of the benefits of them. So first, let's look at your very simple wedge pillow. It's a straight angle. There's only one angle in it. And this is probably what stereotypically you would think of as a wedge pillow. So honestly, the main thing that I'll use a wedge pillow for my clients after surgery is a way to get the legs up and elevated, and also as for some folks, a more comfortable positioning. So all you can do is lie down and just let your legs relax up on the bolster, up on the wedge. The great thing about the wedge for this one is it keeps your knees relatively straight. I always tell people if there's a little bit of bend in your legs, it's not the end of the world, but especially early on as you're starting to try to get that knee extension, that knee straightening after surgery, which is really important. It's good when you're resting, sleeping at night or just resting for a prolonged time, trying your best to keep the leg relatively straight. A little bit of bend is not the end of the world, but it is a good practice, especially early on as you're trying to get that range of motion back. The great thing with the wedges is you can take pillows, one pillow, multiple pillows, put them right on top of that wedge, and then you can elevate the leg up even higher, which means you're going to get a little bit more of those benefits of elevation, helping to reduce some of that swelling and hopefully some of that pain and discomfort as well. I know some folks will sleep at night with their legs up on a wedge pillow. Some people don't tolerate it quite as well. They move around too much or whatnot, but that is an option as well. What I like to tell people is you don't have to be just sedentary when you're lying here with your leg up and elevated. You can do a couple of exercises. So the easiest one, we can do our ankle pumps, pumping that foot up and down. We can do our quad sets, pushing down into the pillows, hold for a few seconds, and then relax. Push and relax. You can do partial straight leg raises, so keeping the leg and the knee straight, coming up and back down. So there are a couple exercises that you can do. You can do glute sets as well. Sometimes I like to even bring in some equipment. So the stretching strap is great. You can use a rolled up bed sheet or a rolled up towel if you don't have a strap. And I like to just wrap that around my foot and just give a moderate pull, feel a little bit of stretch in the calf, and as you pull up you can feel some stretch in your hamstring muscles as well. So stretching those muscles, working on your range of motion a little bit at the same time. The other piece of equipment I like to use the dowel or the stick. A lot of people like to use the rolling pin, or if you get a massage stick at a drugstore or a sporting goods store, works great as well. And just doing some self-massage as you're letting the leg rest and be elevated, helping with swelling, helping with pain management, helping with any stiffness you might be having. So those are just a couple things. I also want to show you a different bolster or a different wedge pillow, a little bit different shape. And that's this one here, so you can see that there's an angle to it, so there's the initial elevation of the wedge, and then it flattens out at the top. So for some people, this will be a little bit more comfortable position because now we're allowing our legs to bend, allowing the knees to bend a little bit. Again, in those first few days, that first week or two after surgery, we're really focusing on increasing that knee extension range of motion. It's really important after surgery. So we want to, when you're resting for a prolonged time, when you're sleeping, we want to try our best to keep that knee straight. It's not the end of the world if there is some bend in the knee. And I actually have some videos that talk about this and debate this a little bit. But for the most part, if we can keep the knee relatively straight early on when we're sleeping, when we're resting for a long time, that's a pretty good thing to do. So usually I'll wait to recommend this till the person is a couple weeks out from surgery, 2 or more, and also you're on your way to having, you're already at either 0 degrees knee extension, you've achieved that level of mobility, or you're very close to that. And just because your knees are in a bent position when you're resting here. Now if you rest with your knees bent for 15 minutes, part of the day, again, that's not the end of the world. Just something to be aware of. Again, with this type of wedge, we can stack the pillows up. So if you want to get a slightly different position, elevate the leg a little bit more, not bend the knee quite as much, you can play around with different amounts of pillows to find what's a comfortable position for you. The one other thing I like about this wedge is we can do a different exercise. We can do the short arc quads where we're keeping that knee against the wedge and we're just lifting, extending the knee and lifting the foot up and down like this. Working those quadricep muscles and working our extension and straightening range of motion. So those are just 2 options for wedge pillows that you can use either before or after surgery, and also some things you can do with the wedge pillows, both for comfort and pain relief. Also doing a couple active exercises while using the wedge pillow at the same time. You can also put heat or ice on the leg as you're resting and relaxing for pain relief, swelling management. So hopefully you got some good ideas from this video. As always, please be sure to hit that like button if you did. Please be sure to leave your comments, your questions below. And I thank you very much for watching.